my name is Judy. I'm going to be doing a NG tube today. My GPSB's been done, my 11 rights. I'm going to verify the medical order for the insertion of the NG tube. I'm going to check the order with the right patient, the right equipment, the right size of equipment. I'm going to identify the patient with the name, date of birth, compare it with the armband with the computer. I will make sure my equipment's already ready to do the procedure, and then I would tell the patient or explain to the patient the procedure that I'm doing and why it's being done. I will discuss comforts that the patient may have. Now I'll go ahead and close the curtain, raise the bed for comfort, and comfort work in order for me. I will position the patient in the highest Fowler position, which is 90 degrees, or in a 45-degree position if they are not able to sit at a Fowler's position. I will put them in semi-Fowler's position. I will measure. I will ask the patient if the patient has any allergies. I'll make sure that I do that. And what I will do, I will measure the tube, which I will get. I'll do my hand hygiene now. And I will put on PPE if it is indicated to wear PPE at the time. And I will do the measurements. How I will measure for the patient will be from the tip of the nose back to the end of the earlobe. And when I do that, and then I will measure down to the xiphoid process, and then take from the xiphoid process 10 centimeters or 4 inches. I will measure it with a tape measure, which I don't have one, but if pretend I did, I will measure it 4 inches. I will take my marker and mark the tubing of it for measurement. And then I will place the tube back into its pack and then set it off to the side. I will drape the patient with a cloth. I will have a basin ready for the patient. I will offer them tissue because of them tearing up, and I will explain to them during this process that you may tear up for it because it's some discomfort. And I will do my hand hygiene again. I will put on a pair of gloves. And then I will take my water soluble lubricant and I will add it from the tip 2 to 4 inches back on the tube. I will make sure my patient has like anesthetics for their nose to help with the comfort and things like that. So what I will do, I will ask the patient first. I will have the patient do the nostril test. And with the nostril test, I will have them to hold one side of their nose, breathe, then turn and do the other side of the nose and breathe. whichever side of the nose that they breathe out the best will be the one that I insert the NG tube in. Okay, and then what I will do with that is I will start out by asking them to slightly flex their head back like this, so I can start the NG tube. I will bring it, I'm going to put it in through the right nostril. Do it that way because that's the one that they breathe out better. Okay. I will start inserting with their head flexed back. I will go along the floor of the nose, upward and backwards till I hit the pharynx. When I hit the pharynx, reach that, then I will ask the patient to kind of lean forward with their chin to their chest, and I will give them some comfort. I will reassure them, everything's going to be okay, give them some encouragement and stuff like that. So when I do that, I will offer them the water, and then I will ask them to sip and breathe as they're getting the NG tube in. So I will slightly place the NG tube, ask them to sip, breathe. Do it very slowly with them. Sip and breathe. And I will stop if the patient has any problems. If the patient is gagging or, anything like that, I'll stop and check for placement. I will take my light. I will check in their mouth with the tongue depressor to make sure the NG tube is not tangled up or anything like that. And if it is, I will get it untangled, pull it back out slightly, untangle it, and then go ahead with the procedure. Okay? And then I will ask them to sip and breathe. Sip and breathe, still keeping their head down to their chin. Keep offering them reassurance for them to sip and breathe. Sip and breathe. And if the patient has any discomfort, let's say they have signs of distress, gagging, coughing, or can't speak or hum or anything like that, then I will stop the procedure, and then I will take the tube out, and then I will have to end up starting the procedure over again. Give them some time to recover. I won't force it. I will rotate the tube if I meet any resistance. And I will just keep having them to sip and slightly put it in. So I'm going to do this a little faster so I can get through this. Okay, and when I get to the marking of the tube, make sure I can see the marking. I will take a piece of tape and I will secure the tube in the nose loosely, as so. And then I will check I will check for fluid, check for the stomach content, the acidious that's in the stomach. I will make sure that it'll be less than it. I will check it on the pH test and make sure it's less than 4 or 5.5. And if it is, it says we are in the stomach. So I'll go ahead and do that test. What I will do is slightly pull out just a little bit of the stomach content, and then I will take the tube, cap it back off, lay it in the tray, and then I will take my pH strip and I will slightly put a little bit on it. Give it a couple of minutes, test it, make sure that it's the right pH balance. And then after I do that, I'm going to go ahead and change my gloves, because I was dealing with stomach contents, so I would rather change my gloves. And what I am checking for when I check the stomach content, okay, I am assessing the color, the consistency, of the gastric fluid. It could be green with particles. It could be brown blood in it, maybe present. And how I will also check is to we could check for it with an X-ray, or we can do it with pulling the gastric salad. And if I am unable to get a specimen from the stomach, I will flush the tube with like 30 mLs of air, and I will have another nurse with me to listen to the sounds to make sure that they hear the air in the stomach. And I need to measure, once I've obtained, and make sure that the NG tube is in the stomach, I will measure the length of the tube again. And how I will measure the length of the tube, I will measure it from the tip of the nose, where the mark is, to the end of the NG tube, to see how much content I have left by the end of the tube here. And then I'm going to take all that, and I'm going to be able to document that in my nurse's notes and things like that. After I confirm the placement, I'm going to apply a skin barrier. On the nose. After I remove this one, I'm going to replace it with put a skin barrier on the nose, and then I'm going to replace it to hold it in place, and we'll make sure that it's in place right and the marking is still there. So what I will do is take and split a piece of tape, tape it from the tip of the nose and the two pieces. I am going to wrap around the tubing, which will help it hold it in place, as so. And then I'm going to take another piece of tape. I'm going to lay it across the bridge of the nose. Stick it to my glove. And then what I'm going to do, since I put the NG tube in the right nostril, okay, I'm going to have the patient to turn their head the opposite way. When they turn their head the opposite way, I will be able to take the NG tube and tape it over to their gown on the side here. And when I tape it to the gown, I will tape it up on their gown, which will be above their stomach. And the reason I'm doing that is so that way if they have any problems, it will be up above their stomach. So by having them turn their head in opposite direction of from where I put the NG tube on the right, I would have them turn their head left. And then when I had them turn their head left, I would take the tube and I would pin it to their gown, which I can either pin it to their gown, I can use tape, I can use a safety pin, and and I will make sure that the tube is turned with the port up, so that way there won't be any leakage or anything like that. And if it's a double lumen tube is used, I will secure the vent above the level of the stomach. If the patient needs any assistance, I will assist the patient with doing oral hygiene. Go ahead and do my hand hygiene. I will assist the patient with oral hygiene. I will encourage the patient to brush their teeth every 2 to 4 hours to keep their mouth clean, moist. It helps reduce thirst. And I will gather up all my supplies, dispose of it. I will go document the size, the type, the tube used, and the nostril that I use for insertion. I will measure the exposed part of the tube, and then I will and characteristics of the drainage in the tube and the patient's response to the procedure. I don't think that I've missed anything, because I did ask them about the allergies, the Levin rights, give them topical anesthesia, give them tissues. I'm just going over everything and checking. Comfort, raise the bed, hand hygiene, do the gloves, 4 inches, place their head back, put their head to their chin. I check for the content of the stomach, and told you about the x-ray if needed. If the gag, the coughing, I would stop, make sure the tube is in the right position, check with a tongue depressor. If it's curled, I would uncurl it and get the procedure. and I don't force it. I would rotate the tube. If I made any resistance, I would stop and remove. If there are any signs of distress like gasping, coughing, can't speak, or any humming, pretty sure that's it, because I make sure that I would be assessing the color, the consistency. I make sure, of the gastric fluid, if it was brown, old, or green with any particles. Let's see. Confirm the placement. I put a skin barrier on there. I think that was pretty much it. So, thank you.